Hello everyone, welcome to another Mighty Explained video. Today we're going to be talking about the tongue and the various cranial nerves that innervate it. To begin, let's do a quick overview on the structure of the tongue and its various segments. So on the top over here we have the root, and then below that we have the posterior 1/3, and then lastly on the bottom we have the anterior 2/3 of the tongue. And over here you can see this dotted line separating the posterior 1/3 and the anterior 2/3, and this is called the terminal sulcus. And so this structure might be a little bit easier to appreciate on like a gross specimen or in an anatomy course, but for our purposes, it's just important to understand that it separates these two segments of the tongue. So let's get right into motor innervation. So all motor innervation in the tongue is innervated by the cranial nerve 12, which is the hypoglossal nerve, except for the palatoglossus muscle. So the palatoglossus muscle is going to be innervated by cranial nerve 10, the vagus nerve, while all the other muscles of the tongue are innervated by cranial nerve 12. So next, on the right side, we're going to get into taste and sensory information. So when I refer to sensory information, I'm referring to pain, temperature, touch, and pressure. So at the root of the tongue, taste and sensory information are both carried by the vagus nerve, cranial nerve 10, and the posterior 1/3, taste and sensory, are both carried by cranial nerve 9, the glossopharyngeal nerve. And in the anterior 2/3, it gets a little bit more complicated. Taste is carried by cranial nerve 7, the facial nerve, and sensory information is carried by the third division of cranial nerve 5, the trigeminal nerve, which is called the mandibular division. So that's all I have for you guys today. If you have any questions, comments, or concerns, please leave them in the comment section below. And with that, I'll see you all at our next video.